Hello again and welcome back. This is the first lecture in part 3 of my multi-part lecture series on the foundations of bioethics. As a review, in part 1 of the series, I focused on broadly defining ethics and bioethics, as well as discussing how to analyze ethical theories in light of one's own worldview and ethical framework. In part 2 of the series, I worked us through an array of ethical theories that are often applied when responding to bioethical dilemmas, and we analyzed those theories using the 3 big questions of ethics. Now, in part 3, the final part of this foundational lecture series, I'm going to hone in on bioethics as a specialty within the broader discipline of ethics. In this first lecture for part 3, I will discuss the birth of bioethics. After listening to this lecture, you should be able to explain how cultural and societal changes in the 1960s and 1970s prompted the new frontier of medicine. You should be able to describe what the new frontier of medicine was, and you should be able to discuss the relationship between the new frontier of medicine and the birth of bioethics. While the broad discipline of ethics dates back to the ancient Greek philosophers such as Socrates, Plato, Aristotle, the field of bioethics is relatively new. Bioethics first started to emerge in the 1960s and 70s. Up until the 1960s and 70s, the medical system had a strict hierarchy with the physician at the top of the hierarchy. The patient experience was not even a consideration. Healthcare was extremely paternalistic. The physician made the decisions of what would be best for the patient, and no one, especially the patient, was expected to question the physician's decisions. The physician was considered the expert. And the general understanding was that the physician was the one who best understood the needs and interests of the patient. In the paternalistic healthcare model, which was the primary model up through the 1960s, most physicians were male, and thus decisions regarding women's health in general were being made by men without the consideration of the lived experience of women. On May 4th, 1969, a group of women from Boston who yearned to gain a better understanding of women's health met at a workshop called Women and Their Bodies. These women entered the workshop as activists trying to make sense of the muddle of medical information surrounding women's health. What they ended up doing, actually, was making history by bringing to light the value of the voice of the patient through the book they published, Our Bodies, Ourselves. During this same time period, the Vietnam War and Civil Rights Movement were challenging the established order and authority through large-scale protests. This was arguably one of the first times in the history of the United States where individuals and groups higher up in the hierarchy became pressured to negotiate and listen to those individuals and groups who historically held little to no power. Healthcare was not exempt from this pressure, as patients began to reject the paternalistic model and advocate for their own autonomy. This push for individual autonomy is often considered the birth of bioethics and marks the beginning of a new frontier of medicine. Immediately preceding the birth of bioethics was the emergence of many of the medical technologies and treatments we rely on to this day. The kidney dialysis machine was developed in 1945, followed by the first heart-lung machine, the predecessor to the modern-day ventilator, in 1953. The first successful shunt was placed in 1962, and the first successful organ transplantation occurred in 1964. Coupled with the push for patient autonomy, these new technologies sparked challenging questions, such as if the technologies would produce more harm than good. Were these new technologies just selling false hope? And how do we define death now that circulation and respiration could be maintained artificially? Just as challenges arose regarding the end of life, new challenges in reproductive technologies created their own ethical questions regarding the beginning of life. Amniocentesis became available to diagnose genetic diseases in the 1950s, followed by surrogacy in 1967 and IVF in 1978. New knowledge and new opportunities brought forth even more new ethical questions, many grappling with the value of life of the mother versus the life of the baby, and the question that still haunts many people today: when does life actually begin, and when does personhood start? New technology is often the result of research, and research begets more research. Prior to this new frontier of medicine, research participants had no rights. There was no consent and no concern about whether or not a study was therapeutic for participants. Most human research was being conducted on vulnerable populations: the elderly, the incarcerated, the mentally ill, and minorities. This age of autonomy, brought forth by the new frontier of medicine, shed light onto the horrors of experimentation and brought forth the need to answer the ethical question of what responsibilities do researchers have, and equally important, what rights should research participants be granted? While these new frontiers of medicine brought forth some ethical issues, there were also some major court decisions that were made during this time period that set some important groundwork for how society responded to some of these ethical questions, as well as how society was responding to increased patient autonomy. Court decisions at the beginning of life were really focused on the individual's right to privacy in matters of sexuality and human planning. So in 1965, Griswold v. Connecticut established the right to privacy for women's possession of birth control. And it was found that this right to privacy was owed to women within the Due Process Clause of the 14th Amendment. This court decision would then further be extended to non-married couples in 1972, also allowing them the right to privacy for the possession of birth control. I think we're all very familiar with Roe v. Wade in 1973, which established the right to abortion. And one of the things that we will look at in this course is the ethics of then the recent overturning of Roe v. Wade. Just like there were court decisions regarding the beginning of life, there were also court decisions that came forth about the end of life, and again focused on autonomy, and this time the rights of the individual to make end-of-life decisions. We are probably all very familiar with the idea of a living will. Some of us may have a living will, your parents may have a living will, and a living will basically talks about what are your wishes for healthcare directives when you're no longer able to verbalize those yourselves. Well, the living will wasn't proposed until 1968. And then in 1980, Satz v. Perlmutter established a competent patient constitutionally protected privacy, liberty, and their autonomy in interest of removing life-sustaining treatment. So again, the patient is having a greater say in their ability to voice their own wishes and opinions about receiving or not receiving life-sustaining treatment. So we just talked about the new frontier of medicine and what that brought forth. And we talked about some of these very important court decisions regarding patient autonomy and patient rights at the beginning of life and at the end of life. And all of these situations, these new advances, they brought forth unprecedented questions of professional values, practice, and relationships. However, beyond that, this new frontier of medicine began to test the established social limits. there were new questions that had to be answered. And I have some of these questions listed on this slide. We now had to consider what new ground rules would govern this new biology, these new liberties and autonomy that patients were receiving, and this new research that was occurring. How and where should and would we draw permissible limits? How do we know what a permissible limit is? And who's going to make the rules that are going to govern this new frontier of medicine? And how are they going to make these rules? And this is really going to lead us into the people that we call the pioneers of bioethics. So the pioneers of bioethics we're going to talk about as the theologians and the philosophers.